Rwanda Development Board has outlined a number of restrictive measures to control the spread of coronavirus for anyone who wishes to visit national parks and other tourist destinations in Rwanda. Now, joining me in the studio to explain more is Emmanuel Nsabimana, who is the head of tourism regulation at Rwanda Development Board, RDB. Thank you so much for joining us.
Thank you, RDB.
Yeah. So mandatory testing of tourists who are visiting different tourist destinations in Rwanda. Why at this particular time?
This particular time, I think you can remember that on the 16th of June, the cabinet decided to resume the tourism operations, and it's a gradual, resuming of operations, business activities. By then, we were required to come up with mandatory, guidelines that will help us to ensure that we keep preventing from COVID-19 spreading. This mandatory, not just now. Any other business, in any other business, whether tourism or not tourism, we are required to ensure that we keep, prevention. Now, these guidelines, I think there was a new news today or yesterday that has come as a change, because normally we're supposed to test when we are visiting mountain gorillas and the Nyungwe National Park. But yesterday we introduced also the mandatory testing for Akagera National Park. But I think all this is through assessment that our health officials are doing. From that, they see that COVID-19 has gone complete. It has not gone completely, so we still have the pandemic within us. So therefore, we need to make sure we are so safe. So our staff are safe, our tourists are safe. Actually, our animals are safe. So in terms of ensuring safety, that's why we put that mandatory testing. And we think that, especially for the international community, it gives them confidence that Rwanda is doing well in terms of preventing their people. So therefore, that's why we require the testing to be mandatory when you visit.
I want to understand, don't you think this will reduce the number of tourists you expect? What are the measures that have been put in place to make sure that the tourists are able to access testing easily?
Yeah, I don't think so, because the lockdown from March to May or June, tourists were zero. So it's not going to affect the numbers because it's a gradual reopening. Since we opened on 17th, it's now not even 2 weeks yet, but we've seen already numbers coming up. If I give an example of Akagera National Park, we are recording about 550 people who have already visited within the 2 weeks.
Since 17th?
Yes, since 17th. So that means that actually it's not going to affect the numbers, it's rather giving confidence. We've introduced, a number of measures to ensure we increase the numbers in terms of giving discounts, especially to the local market, because as you know, the borders are still closed. International tourism is not yet, resumed, although we are working on a charter basis, private jet basis, but we are depending more on nationals, the Rwandans, and also experts within the country. So what we did, we introduced a number of discounts on the rates that we are charging within national parks, and that is actually driving a big number of people visiting. Already in Volcanoes National Park, 45 people have already been recorded for mountain gorillas, I think, which is a very tremendous achievement for the last 2 weeks.
Okay, so what next? Going into this mandatory testing and, of course, the gradual reopening, what should tourists know in terms of Rwanda's openness to tourism now?
We're still open, and I think the test itself, I think they should take it not as a mandatory, rather as a complementary product we are giving, because we are not even charging the test. What we are doing, we are ensuring you are safe, but we're also letting you know that you are not positive, by the way. I think everyone would want to have the test to ensure that, I'm safe, I'm not sick from COVID. So what we are doing, we are continuing to give that free service to the tourists, whether international or locals, for all the 3 national parks, but also continuing to, to increase the campaign. We are reaching out to the international tour operators. Well, we haven't yet recorded any, private jets coming, but, they are promising numbers. What we are trying to do is to continue to explain the guidelines, the mandatory testing, other guidelines associated to that, because when it comes to international tourists, for instance, after the testing, there's a time to wait for your results, so there are certain protocols around that. We are making sure that the protocols are understood by the tourism community. so that it becomes easier when somebody comes, so he knows what is expected from him and what he expects from Rwanda as a tourist and tourist destination.
That period of waiting for the results for testing, what happens? Is the tourists supposed to foot their bills? Is there any way you're going to be supporting them?
Well, it's going to be a caution, I think, because that's why we do it in advance. We inform them in advance so that, you know, again, we are talking about health of people. Health of people. What happens when they land at the airport, they get a free testing, they get free transport, but they will have to pay for the transit hotel because they have to stay in a designated hotel for about 8 hours waiting for the results. So in designated hotel, they will have to handle the bid, but they are aware, the tour operators are aware, when they put packages, that factor is factored into the cost they are going to charge. So it's a cost-share kind of. So transport and testing on the government side, but then also the hotel now, the tourist also comes in and pays. I mean, we also need to grow our income, our economy. Yeah.
Very briefly, Emmanuel Nsabimana, as we conclude, how long are we going to have these complementary packages from RDB? Because clearly they have facilitated the growth of tourism in this short period.
Well, I think it will depend on you know, how the situation evolves. The COVID situation, you know, gets evolving. But the strategy that we have by now, it's for 6 months. From now up to December, that's actually the short-term, you know, strategy we're working on. Probably by December, we shall revise and see if we can continue to give. But up to that time, we are still giving the complementary testing and that particular transport service.
Emmanuel Nsabimana, Head of Tourism Regulation at RDB. Thank you so much for your time.